Dizzy, Ted. Almost strikes to Grog-Zentral, but then you shut down.
The Apley scratch test is a quick, active range of motion ROM screening test for the shoulder that evaluates the ability to perform combined shoulder movements. It is not a single maneuver but consists of 3 separate movements, each testing a different plane of shoulder motion. The 3 maneuvers: abduction plus external rotation. The patient reaches behind the head and attempts to touch the upper part of the opposite scapula with the fingertips. For example, take your hand behind your head and touch the top of your opposite shoulder blade. Tests: abduction and external rotation of the glenohumeral joint, primarily involving the infraspinatus and teres minor external rotators, and the supraspinatus. Abduction. Adduction plus internal rotation, behind the back. The patient reaches behind the back and attempts to touch the lower part of the opposite scapula with the middle finger. For example, reach behind your back and try to touch the bottom of your opposite shoulder blade. Tests: internal rotation and adduction of the glenohumeral joint, primarily involving the subscapularis. Internal rotation. This is the most commonly limited motion in conditions like adhesive capsulitis and rotator cuff pathology. Cross-body adduction. The patient reaches across the front of the body and grabs the top of the opposite shoulder. For example, grab the top of your other shoulder. Tests: adduction across the body, which can stress the acromioclavicular AC joint and posterior capsule. Positive versus negative test. Positive: the patient reports local shoulder pain during or at the end of any of the 3 movements, or is unable to complete the movement. Limited ROM compared to the contralateral side. Negative: the patient completes all 3 movements without pain and with symmetric ROM bilaterally. What to ask the patient? Ask, do you feel any pain in your shoulder during or at the end of this movement? And compare side to side for symmetry of reach. Don't forget to ask the patient to switch sides to access the full range of motion with all movements. What a positive test suggests. The Apley scratch test is a screening tool. It does not diagnose a specific pathology, but rather identifies restricted or painful shoulder ROM that warrants further evaluation with more specific provocative tests. Depending on which maneuver is positive, pain/limitation with behind-the-head reach implies consider rotator cuff pathology, especially supraspinatus, subacromial impingement or glenohumeral stiffness. Pain/limitation with behind-the-back reach implies adhesive capsulitis, loss of internal rotation is a hallmark, subscapularis pathology, or posterior capsular tightness. Pain with cross-body adduction implies consider AC joint pathology. This maneuver is similar to the cross-body adduction test, which has approximately 77% sensitivity and approximately 79% specificity for AC joint disease. Key clinical point. The Apley scratch test is best used as a rapid screening maneuver during the initial shoulder examination to identify which planes of motion are affected, guiding the selection of more specific diagnostic tests, for example, NIR, Hawkins-Kennedy, empty can, liftoff, for definitive diagnosis. Thanks for watching. I am a registered nurse, MSN and NP/DNP student, and Daisy Award winner hoping to brighten your day. Don't forget to like and subscribe for more content. If you want to see something here, leave a comment below or contact me at buyerinstitute@yahoo.com.